There are conversations, and then there are conversations that change how you see everything. Because what happens when the system meant to care for you is the very system that causes harm?
What brought me to this work is just my own personal experience. So I was a teen mother, and when I would express like things being painful during exams, like my doctor would say, well, were you saying that when you were having sex? He just challenged me to explore, to see like, was it just me?
No, I had the same experience. Because behind every statistic is a real experience, a real moment, a real woman who hasn't and wasn't heard. And for too many Black women, that moment happens inside the very spaces meant to keep them safe.
And some providers really like coming in with these tropes or stereotypes about Black women. This kind of like, these stereotypes follow them in the birthing space to where, you know, people aren't really taking their concerns seriously.
Today's guest is Dr. Brittany Chambers-Butcher, a tenured associate professor at the University of California, Davis, and a nationally recognized researcher in reproductive justice and Black maternal health, redefining how we understand racism in the healthcare system through the lived experiences of Black women and designing real solutions that actually meet community needs. In this conversation, we go beyond the data into the stories, the trauma, the gaps in care, and what it will truly take to create change.
With your host, Jessica Walker.
Brittany, thank you so much for coming. I'm excited because I saw you speak recently. What was that? What's the name of the panel that you were on, the summit?
So the policy briefing focused on Black maternal health.
Yes. So how did you get involved in this work? What brought you to this work? Let's start there.
Okay, that is a great question. So what brought me to this work is just my own personal experience. So I was a teen mother. So I got pregnant with my daughter at 15 years old.
Oh, wow.
And I had to navigate, you know, healthcare settings. And I would just receive some horrible questions. Like people were like, how old are you? You know, I'm checking in, you're too young to be having a baby. And then when I would express like things being painful during exams, like my doctor would say, well, were you saying that when you were having sex? And so
you just triggered me.
Yeah, so those are my experiences.
Yeah.
And so that really just challenged me to explore, to see like, was it just me? Like, am I tripping? Or
no, I had the same experience.
You know, is it something that's going on with other people? Is it because I'm a younger mother? It's because I'm Black? And as I started to explore this a little bit more, I realized it was all the above.
Yeah.
And that this was something that actually like grown women who are Black experience navigating care. And so I was really interested in like centering people's stories. I have a bachelor's in anthropology and then went on to the public health track and really just centered on community. So how do we make sure that as we are designing programs, as we're thinking about interventions, as we're thinking about policy, that, you know, community voice is centered, because we know things evolve and change over time. And so how do we make sure that, you know, we're still in today's time and centering today's experiences? Yeah.
So when you were on that panel, I was like, oh, because I had interviewed one of your folks in the work, and I'm losing their name, but anyway, she was one of the episodes, I'll put the episode here, that she was on. And we talked a little bit about the study that you all put on. Why I said that was triggering is because I experienced the same thing. I was 17, almost 18 actually, excuse me. My baby's almost 28 I think now. How old is your baby now?
20.
No, oh my goodness. It's the different world when they become adults, right?
Yes.
It is being a teen mom, and that experience was one thing, and then being a mom of an adult is a completely different. It is just like it's interesting.
Yes, I would say just yesterday my daughter was like, "There's something about 20." I'm like, "Girl, what is it about 20?"
What is it about 20?
She's like, you know, she's an adult, she's learning these things.
Tell me a little bit about the study that you put on, because the study, when we had this conversation before, we really centered on the participants of the study and what they got out of it, but we'd love to hear the back end of all of that work.
Yeah. So the Embrace study, it is a community-based study where we have the entire time been partnering with the Black community. So our community engagement lead is Dr. Venice Curry. She is a Black woman, PhD. She is from Fresno, been in Fresno. And so just from our standpoint, as, researchers, I started off my career at UCSF. I'm now at UC Davis. I got my master's from Fresno, so I know the community a little bit, but, I'm not there, right? And so we felt like it was very important, given the historical traumas, to make sure that we're partnering with community, that we're not just parachuting in. And so this has been a partnership between the Fresno community and the California Preterm Birth Initiative at UCSF. And so they helped them design one of the comparators, the GLOW Group Prenatal Care Program. So the Preterm Birth Initiative funded that, that initial work. And from there, this partnership emerged with the community, and they continued to work together to really say, hey, we see that this group prenatal care program, that women in it, they enjoy it, they attend it, they feel like it's better than, the care that they receive. Now the next step is us to see, does this really improve their outcomes? And so we have been doing this study before the pandemic. So the pandemic put a little hole in it. It's been like 7-ish years. We just completed it because we launched 2019.
Wow, that's amazing.
And we enrolled our first couple of people over the winter months, and then boom, here comes March, here's the pandemic. And so, you have people who are in person, receiving care, who can no longer be there.
And then how do you navigate that whole thing?
Yes, so we had the enhancement part of the study, which we had to work with people to kind of say, how do we actually translate this to a virtual environment? And so my role on the project is really influencing the measures around racism and discrimination, and leading the qualitative component. And so for the qualitative piece during this phase, we were really trying to explore how is this pandemic impacting you? Because for us as Black people, it was not just the pandemic, right? We saw it was a new rise of the Black Lives Matter movement. It was a lot of things shifting, right, in our communities. And so we kind of explored that area. And then we also explored do you want to be in person to receive care? Do you like being out? In the qualitative component, we kind of centered Black women and Latin women. And so their experiences are very different, and what they want is very different, right? And so we were really trying to make sure that as we were moving to this online space, because we didn't know how long we would be here, could we still implement group care? In the group care model, there is, the GLOW model, there is an OBGYN that's there, and then there's a facilitator who's from the community. And so what they decided to do was during the pandemic, the facilitator would kind of lead, the groups, but it was more so a support group during that time. And, the provider wasn't able to actually provide the type of care that group setting calls for it, right? In the group setting, you're taking your own urine samples, you're doing all this stuff yourself, and then you're talking with your doctor about it, right? So it really is not that opportunity for the provider to be there to kind of help look and support and do all that. And so we did that all through the enhancement phase. And then when everything opened back up, then we're like, okay, we're back in person. What we did find out, though, from the data is a lot of clinics didn't close in Fresno. Only a few did, right? So just given the community, they're just our community don't really have access to things to be able to have adequate care on the phone or online. And so a lot of them still were intact, but they couldn't do group because group violated, COVID protocols. So it was such an interesting time, but we gratefully from the funder, they allowed us to have this enhancement phase to kind of figure out how will we do this? How can we do this? Because if we're going to be in this space for some time, we need to figure it out. And then everything opened back up, and we were able to get back going.
It sounds like it was just like this.
Yes.
Up and down, up and down, up and down.
And our primary outcomes that we were interested in were mental health. And so we have a lead, Jen Felder, in the field who's really She does a lot of mindfulness studies. She works with pregnant people who struggle with depression and anxiety. So we have measures of depression, anxiety, of stress, also patients' experiences. So Dr. Peshna Fulani leads that piece. She has one of the only publicly available patient experiences scale outside of Dr. Karen Scott, who has the obstetric racism scale. And so she's leading that piece. And then I'm leading work around discrimination within healthcare settings and the qualitative component that actually looks at all of those things from a qualitative standpoint.
Nice.
So yeah, we are literally, the past couple of months, we've been chunking out papers from the full launch. And so,
Wow.
you know, we'll be disseminating data like really, really soon.
Awesome. I can't wait. I'm looking forward to it. You definitely got to make sure you let me know.
I will let you
what
know.
list do I sign up to make sure that I get a
I
notification?
have to see what the list is.
Yeah. Please let me know. So that leads transitions really great into this next question. How does systematic racism affect Black women's mental health during pregnancy and postpartum?
You know what? That is such a deep question. And I feel like if we don't look at it from that standpoint, that we would miss out what's going on with Black women from a mental health perspective.
Right.
So just during the enhancement phase of the study, we talked with women about, you know, the Black Lives Matter movement, the deaths that they were witnessing, you know, on social media, as well as how living in a community that doesn't primarily look like you, right? Fresno is predominantly Latino. And so like, how is it navigating, right, in those spaces? And some things that came up from Black women in particular is they were afraid if they were pregnant with a son, they were just like, I was praying that I was not having a son, because if I have a son, I'm already worried about what age I have to have these conversations with him about what he should be wearing, what he should not be wearing, how to act if, you know, you get pulled over. And it takes away his innocence. It takes away his childhood. But if I don't prepare him for this, right,
then what happens?
Then, you know, what happens to him? And so that was like one of the biggest things that kind of came up out of that. There was also kind of like some discussion around, you know, whether they lived in a community that was for them or not, and whether or not they felt open to kind of like, you know, openly say, okay, I am for this, but feeling good when they saw their community out there protesting and saying, okay, people actually care about us, right? But then there was also this side where people were just like, well, hold up, we're still going through this? Like, I thought this was over. And so that was also this new introduction of this new trauma that they were just unaware of, right? Now when we think about the birthing space and prenatal care and how racism shows up there, Black women talk about providers really like coming in with these tropes or stereotypes about Black women, and just receiving crazy care. Literally, I'm writing the manuscript right now. One woman, she had 2 previous preterm births, so she was at risk. And she was at an appointment with her provider, and her provider was telling her about progesterone, and she was just like, oh, well, what is this? I've never been offered this before. And he's like, you're an educated Black woman. You can go and look and find out the information.
Wow.
And so, you know, she talked about, you know, that experience. And so this comes in, right, is like, oh, you, the educated Black woman can't get any resources, right? Then we also have stories where Black women come in and they say, they instantly get asked, oh, like, are you a single parent? Although their partner is sitting right behind them. They just don't believe that they, you know, should have, you know, a partner or anything. And this kind of like, these stereotypes follow them in the birthing space to where, you know, people aren't really taking their concerns seriously. And women talk about this trauma that comes from having a horrible birth experience. And so I feel like that's one thing that I'm really interested in studying more, because people talk about having, you know, mental health challenges, having anxiety, even the moment they step into this new pregnancy from what happened the last pregnancy. They even talk about how during the postpartum period, how they're not able to connect, or, you know, do the things that they desire to do because they are still reflecting on the horrific birth experience that they had, not to mention the moms who are separated from their children, and, you know, their children are in the NICU, and not getting the support that they need, right, to kind of help, you know, facilitate and be there. And even being, they talked about people like really like stressing like, okay, you should be breastfeeding, but if the mom is not producing milk or not in the mental space to do that, of feeling judged, right, of not being able to provide that. And so I feel like when it comes to Black women, that the current measures that we use to measure depression, anxiety, do not adequately account for these exposures to racism. And so, like, you know, what I have been like proposing in the discussion that I'm kind of writing about right now was like, there needs to be some measures that look at the interconnections of these, right?
Yes.
And we really need to talk with people to understand these interconnections because, you know, our normal day is, you know, someone's high level of anxiety, right? And so I think those are the things, like when you're asking these questions, like first you're like, I've been dealing with this since I was this age, so I'm not going to answer in this particular way. But when you bring in these questions about racism, about being treated differently, about worrying about not only yourself, someone you love, that they're going to be experiencing racism, you know, the numbers change.
Yeah, no, we on one of our previous episodes, we talked a little bit about just the stress levels and the fact that a lot of things that are happening with your body are stress induced, and that stress stems from a lot of the historical things that have happened in your life, and you don't even acknowledge it sometimes, right? You just kind of keep going, keep on moving, and like you said, an average day for a Black person, whether female or male, could be like the most stressfulest day for someone who isn't, right? I can account for different times when I've gone into grocery stores where I've had multiple different, you know, microaggressions that have happened. You know, the person in front of me gets, it's taco night, and then I move up and it's like, that'll be $6.95. Like, it's a nuisance. Like, why are you even here in line when you work here, right?
Like, this your job.
This is your job.
I think that is something that's super important. So I think one thing that's lacking, like in the Black community is, and I do studies where I talk with Black women to ask them, how do they define racism? Structural racism in particular.
That's key.
And a lot of them don't know.
They don't acknowledge. Yeah, and that's what I'm saying. I know. So I pick up on it. So I try to change the environment around me, so to speak, so that I don't take the brunt of whatever this person is carrying with them with me outside of that grocery store, right? So I change it up. Oh yeah, it's taco night for me too. Yeah, I got lettuce, I got cheese, I got sour cream, you know.
I got all the things.
Yeah, and then all of a sudden it's like a shift, and oh yeah, you know, I love a burrito. Yeah, you know the place, so and now I'm not taking and carrying that on my shoulders. I'm leaving you with whatever biases you have right there. You keep that. Yeah. Don't give me that. But I agree. Acknowledging, and then the awareness piece of knowing that that's happening, because it's happening whether we say that and pinpoint it or not, and that stress level we're still taking it with us.
It's still there, right? Because like the, you know, the weathering hypothesis, Geronimo's, right, the article, like, is saying, you know, we were exposed to racism in our mothers, you know, ovaries, right? Like she was just walking around living her life, not thinking about having any children. Her exposure to racism impacted us, right? Before we were even born, and then it continues to impact us, right? And so if people aren't aware of it, right, then how can you even act on it, right?
Exactly.
And so I think that is kind of super interesting. In this study that we've been talking about, I've seen some discrepancies in data points. So quantitatively, we had survey administered interviews. We'll ask someone, okay, do you feel like your provider treated you unfairly? They'd say yes. Qualitatively, we'll ask them, have you experienced any racism? No.
Exactly. Yeah.
Right? And so that has been
connecting those dots are
blowing.
Key. Connecting those dots are like the major key, because anyway, okay.
I know. I'm aside.
We're gonna need a part 2. So based on your findings, what changes, in training or policy would most immediately improve mental health outcomes for Black moms?
So I think having a policy, so actually to take a step back, we did research prioritization for affected communities protocol with the stakeholders of this study, and we had them identify like questions that were important to them. And one thing that came up is like, how do we get people access to mental health resources that are available to them, right? Mm-hmm. And so the resources are available, but the people aren't coming. And one thing that we also had some participants in this, and one thing that they said was like, well, the framing of it isn't for me, right? And so I think one of the key things was going to be hard in this administration is it would be nice to have an initiative that's focused on providing funding people, right? Like we need to have all the way from social media, right? All the way to, the caseworker, all the way to, the social worker or psychologist who's going to be providing the care, to have Black teams, right, who know the community, right? Yes. You need to be a part of this community because they need to trust you. Yes. They need to know you. Yeah. But how do we get funding to fund like these small orgs or these small clinics to actually increase their exposure to help these patients, right? Absolutely. Because the Black moms was like, for one, I don't trust them, right? Yep. I may get reported for something that I say. Yeah. The information that they're providing to me, like I don't want to say that I have this, right? Yeah. And so that's thing. It's a stigma in the community. Yeah. And so how do you offer this resource in a different way, right? Absolutely. And then I feel like there needs to be policy that supports follow-up, right? So we've been doing good with this policy around, okay, let's extend to 24 months for postpartum, right? But what happens in between pregnancies, right? Yeah. What happens before the pregnancy, right? If we know that preconception is important and it matters, but preconception women do not exist when we talk about these outcomes, right? There's no program for preconception women. Yeah. There's no funding being laid into preconception health. Yeah. So I feel like those are things that really came up from that community.
And they concepted.
Yes.
They out here concepted.
Yes. And then they talked about... They talked about that people work in silos. So like someone can be in the OBGYN department and someone can be in the psych department, but they're not talking to each other. Right. They're not making sure, right, that they're doing these warm handoffs. Absolutely. And so there really needs to be like some policy that supports like linkage to care. So I started off my career as a student in HIV research. Okay. And for adolescents, there's so much like studies going on linkage to care. What happens when you phase out, right, of care as an adolescent and you're going to adult care? Right. Those environments look very different. And it's the same for pregnancy, right? What happens when you transition from prenatal care back to your, primary care, your primary provider? If you transition to, psych department, like what happens, right? And so I feel like there's really no policies that care about women. They all care about the baby. And I feel like that has been, I'll take it back. We have a few policies that care about women. A few. But I feel like...
I think we're starting to,
yes.
I think that's the difference, right?
Yes.
When I was talking about postpartum depression and anxiety 10 years ago, even 15 years ago, people were looking at me like I had 3 heads. Like, what? Huh? What? We're doing everything. What are you talking about, right? Now, you can go on social media or whatever, and it's just like, oh yeah, maternal mental health, postpartum depression, anxiety, all that stuff. My mom always kids and goes, you were the first person I ever heard talk about that, right? Yeah.
Because we don't talk about it.
We don't, and now I feel like the conversations are starting to happen where it's starting to be more of this topic, right? There's more of a conversation around it. You know, when I saw it on the Real Housewives or whatever it was, I can't remember which one it was, but I was like, oh, they're talking about, I lit up. But so I think there's starting to be that conversation. But you got to think, we didn't talk about therapy for a long time either.
This is true. And I think also proposing different types of models, right? So like, I think having group, so like, one of the quotes I kind of said with me is like, some of the women shared that group was like therapy to them. It was nice to be able to come into a space and have that, right? Same thing when we think about the Black infant health, people enjoy the connections they make, the friendships that they make. Yet there's really no funding for these programs post a certain time period, right? Once you're out of like the postpartum time period, it's done. There's nothing before to prepare you, right? You know, for the pregnancy. And then I feel like also it's called postpartum depression, but like also, how are we taking care of the mother, right? And I'm telling you, like this, and from a research standpoint, people ask me this all the time, like, I study women. I work with women because, you know, if we make sure that mom is well, everyone else is going to be well.
Because we are usually the caretakers in most situations, right? Most circumstances.
Most situations, right? Yeah. And so I would love to see policy that looks at, you know, how we have, here's a visual, my brain just went there. So you know how we have those videos when we talk about life course and how, you know, like you're small, So it would be great to have a policy that proposes interventions to support the mental well-being of Black women, birthing people, and the men too, because like we can't forget about the men because it's a family, right? So how do we support along the way and not just saying, oh, here's someone who's pregnant, they may, you know, we know they're struggling with racism and you know, because of exposure to racism, you may come with more complications, right? And so that is not the place where we should be thinking about intervening, right? It should be before
all of that even takes place. Absolutely.
And so that would be an ideal world. I don't know how we would get it, but I feel like that would be the really grand level thing. But just on the smaller level, what people have told me, like, we need an awareness campaign. I haven't seen one in California. Awareness campaign with people who look like us that gives us the numbers, the stats. What does it look like, right? Because some people don't understand what it looks like. And someone talked about, you know how we have all these hotlines? So like, I feel like Hotline Doula is like one of the best hotlines we can have. What would that look like for mental health, right? Because people are like, I don't want to call, like they said, people give them the suicide number. Like, I don't want to call them. I don't want to call them. I don't know. They don't look like me. They don't understand me, right? And so that would be the thing. And then just a policy to connect people. Like, I don't know if it would be like, you know, you should have a mental health specialist within the OBGYN department.
Yeah, you should have a care team, right? There should be a care team there.
Yes. So those would be those. That'd be what I would
There's some reasons that they won't do that, but I want to talk a little bit about your tenure as a professor. How do you mentor students or future researchers who want to pursue reproductive justice or maternal mental health?
So that's a good question. So I love mentoring students. I feel like I don't have enough time to mentor all the ones who, you know, reach out. Yeah. But I breathe, sleep, and do work for reproductive justice. And what I mean by that is when people come into my lab, I give them foundational readings around reproductive justice, what it is, what it's not. I work with Black women, right, primarily, and Latin women primarily. And so I have people who come into my lab who represent those groups and who do not. And so when I train them from a reproductive justice standpoint, which is research for us by us, but we do have allies. And so I'm training people to understand, like, okay, what is your role in this work and how do you do this work, right? Not X anyone out, but like you need to know what your role and responsibility is by being an ally to the space, right?
Absolutely.
And so this is something that I feel like is super important because there's a lot of people who want to help and don't know how.
Yeah.
And I feel like, we need to kind of tell people, okay, based upon your positionality, this was what it would look like, to help me. I've had some, white women, like, I want to fund some of your work. I'm like, thank you. And then she went beyond that and she was like, well, you know what, I actually want to teach you how to fundraise and what you could do to get people to kind of like piece,
That's amazing.
Things together. And so I was like, from a reproductive justice standpoint, she understood where she was at. She understood what resources she wanted. She didn't want me to depend on her. Like, how can I help move that, right? And so I teach students, like, okay, if you belong to the community, you need to first go and make connection with the community. We have community members that we work with on a consistent basis, and they are the center of the work. And so that means if we have a deadline and the community's like, this ain't it, we ain't making that deadline, right? They're like, what? Like, it's crazy, but that is really how you do the work and how you build the trust. And then also for our people, I call them allied to the cause. Like, I'm like, there's stuff for you to do, right? There, like, you can help and support the research in different ways, whether it be coding, transcripts, whether that be doing some data analysis, whether that be creating flyers.
Yeah.
We had one who wanted to create like, things that we would mail, postcards we would mail to participants in between, studies to kind of get them excited about these interviews is about to come up, right? There is so much to do on a study. And so many skills that you continue to learn, but I think it's important for us to also be training, people who can be harmful, to us as well in these spaces. And my students of color really appreciate it because they're just like, I've never seen anyone who's done this before. They also speak about all of my students not having someone who's available. They're like, I have mentors and they're not available. And so I feel like it's important for me, for, our Black and brown students, for me to be available to them, for me to be able to help and support them and walk them along the way, right? Because when we're thinking about justice, it's not, we just saying, it's just like when you're in a position of power. For myself, how do I actually use the power that I have, right, to help students, to help community, because if I'm not doing that, then I'm not really operating within, right, the reproductive justice framework.
I love that. I love that. You've received, I have one more question after this one, but I want to touch on this. You've received awards such as the APA Outstanding Young Professionals Award and the NIH Grant Award. How have these shaped your work and visibility?
I would say substantially. So I would say getting the Maternal and Child Health Young Professional Award, like, that is the biggest public health global organization, right? And so by being there, serving and then actually being recognized, like, for the work, that I have done, it was just phenomenal. And after that, people are coming, hey, let's partner and see how you can do some community work, with the section. And literally just everyone who is somebody is in that room, right? And so it just opens up more opportunities, right? It opens up additional opportunities to expand the work. And also, I would say, from a standpoint of like talking to different groups of people about like what we're doing in California. Because from there, I got a lot of emails like, hey, I want you to come talk here. I want you to come talk there.
Right.
And
there's
so
a lot of opportunity.
Yeah, it kind of like opens that up. And from the NIH, so I got an NIH K01 award, and that's a training grant. It is one of the grants that people say kind of like determines if you're going to be successful as like a full professor, right?
Oh, okay.
It is like a training.
No pressure, right?
Yeah, it's a training grant. So if you get it, it's like you're good because it covers your salary, 75% of your salary.
Oh, wow, that's amazing.
For 4 to 5 years. So it gives you time to do research. So you get time to develop who you are as a scholar without worrying about your department pushing back and saying, you can't do this research because for you to get a paycheck, you need to be leading this organization, that. You need to be doing all this, right? And so,
and also keep your part-time job at McDonald's, wherever you work, right?
Yes. So it was nice for that standpoint. And then it also got me into NIH, where we have program officers where I'm able to talk to about my work, where I'm able to kind of say, hey, this is where I'm at. What are different opportunities? And then it also taught me, like, you know, I want to continue, although this economy is crazy, I would love to continue to get NIH money because they're one of the largest funding entities, right?
Absolutely.
It's rare that you could get a $5 million grant, right, from a lot of people who fund work for,
Absolutely.
you know, 5 years. They also do training grants, right? They are like the number one place that we go to as faculty as well as universities to fund the infrastructure, you know, of our work.
Yeah.
And so having that grant was really foundational because it showed, like, okay, at this phase of her life, she's able to get this particular grant. And so it kind of lets people think, okay, she's on the track record to, you know, get her first R01.
Yeah.
Which I was before this president. So now I have to make a little pivot.
Right. Well, other things will take its place, right?
Yeah.
For healthcare providers, community leaders, or families listening, what's one action they can take now to support Black birthing people's mental and physical health?
I think one thing that people can do that is so easy is to ask any Black woman, a birthing person of reproductive age that you know, particularly pregnant people, like, how are you doing? How are you doing?
Yeah, and actually listen to
and
the
listen
answer.
to them. You don't have to bring up mental health or whatever, but you can allow a safe space for them to share. And then based on what they share, you know, then you can, for providers, then you can provide the resources, right? Then you can do the linkage, right? For community people, you know, there are more direct services that community kind of has. And so community can be like, okay, you're going through this. We actually have this group. We have that group.
Right.
Let me hook you up with this doula. And then for family, it can be a simple like hug and let them know that you're not alone, and to share a story where you went through something similar to kind of normalize mental health challenges, right? So I think I hit.
Yeah,
I think I hit your.
Is that kind of what you are hearing across the board from a lot of moms, and the support that they need?
Yeah, so moms are saying, like, Black women, people are not talking about it. So there's a stigma around it. So, and it depends. It gets complicated, right? If someone comes from a religious background, like, pray about it, right? That's what it's given. Where we see now more younger pastors are kind of saying, hey, both can go together, right? Both go together. And so it's a whole slew of things, but the common thing is that, you know, I don't talk about this. People are going to perceive me as crazy, right? Or my parents say, I don't need to have another label, right? What happens when I have another label on me? And so I'm already Black, I'm already a woman, now I have this mental health diagnosis, right? And so that's additional stigma, discrimination that they may experience. And there is one patient actually that comes to mind who actually challenged her provider because she did have mental challenges, and she said the way that her provider, and she was on medication, the way her provider talked about it, she went to like OBGYN for labor and delivery, and she had like, she didn't deliver, but it was just like something was happening, she went to check it out, and they were basically classifying her as a drug user. And so she was just like, she had to go back and say, hey, you need to kind of redo this. I'm not, you know, a drug user. I'm on these medications for my mental health condition that you know about, right? And so those are people's real experiences. And so, you know, the first thing that needs to happen is create a safe space for Black women to talk about mental health. It is coming, but I also feel like we don't talk about it that much. And I feel bad saying it out loud, to be honest. But I think we don't talk about, you know, what we're talking about as academics versus what's going on in the community. Right. And there's a big difference. So what we're talking about as academics, yes, we're moving, we're transitioning. What we're seeing we're getting funds for, we're moving, we're transitioning. But when you go to the community, are they going to be like, oh, yeah, I'm going to come to this? Or are they going to be like, no, I'm not going to come to this program, right? And so I think there's a disconnect at times between what we know
think is we
and
should
what
be doing,
we think,
versus what they want,
and what community is ready for at this moment, right? And so I think it's slowly unwinding, but I do feel like, and I've heard from community, particularly in Fresno is what I'm talking about, that there is a need to first like increase awareness and safety about talking about these issues.
Man, ooh. We definitely got to have you on for a part 2.